A new scenario in oncology is really the changing landscape and practices that have emerged from the first wave of the COVID-19 pandemic. This edition really spotlights some of the lessons that we have learned during the pandemic. The simplification and the rationalization that we can bring to clinical trial, but also some negative, such as the lasting toll the pandemic has taken on cancer screening programs. In fact, as we reallocated resources and deferred what we considered to be non-urgent healthcare services, screening programs have often been among the first cancer-related interventions to be shuttered. This is particularly true in low and middle-income countries where these programs operate on somewhat shaky funding. But if they reopen at all, they will open to a significant backlog of interventions, and the price tag for these missed early diagnoses or missed screenings is actually thousands of additional cancer deaths due to diagnostic delays alone. So what really seemed as an easy enough sacrifice in the short term turns out to have a compounded downstream fallout. A finer analysis you will find in the magazine addresses the behavioral patterns during pandemics and highlights the increase in fatalistic attitudes, but also the fact that people that are most effectively kept away from hospitals and other important healthcare services are really the lowest socioeconomic groups again. As an oncology community, we really need to learn these lessons, the high price we are only now starting to observe, and rethink what interventions we really want to sacrifice if indeed we have to reallocate resources again. It's important that we try to learn from our mistakes, not to compound and repeat them.